Willett, one of the authors of the Nurses' Health Study in 1976, noted that when he started, research on diet was almost entirely focused on heart disease. But he notes that he's seen the effects of diet on almost every condition he's looked at: cataracts, diabetes, gallstones, infertility, kidney stones, or macular degeneration. It's not total fat that's the problem, it's type of fat. Trans fat is worse than originally thought. Factors in weight maintenance. Ghrelin is secreted by specialized cells in the stomach. It sends messages of hunger, spikes before meals. It is involved in the short-term regulation of hunger. Leptin is a protein hormone produced in adipose tissue. It sends the satiety signal. CCK is a peptide hormone produced by the intestines that acts on the brain to produce feelings of satiation. Two parts of the hypothalamus are involved in eating. LH, lateral hypothalamus, this tells you to start eating. VMH, ventromedial hypothalamus, this tells you to stop eating. Satiety center. Obesity. Obesity is a body weight in excess of 20% above one's ideal weight. 67% of the adult population in the U.S. are overweight, and 34% are obese. Although the stereotype is that of a jolly fat person, they are more at risk for depression. Ways of measuring body fat. Skin fold technique involves measuring thickness of a pinch of skin. It is not very accurate, although easy and inexpensive. Water immersion technique is where a person is lowered in water to determine the amount of displacement. This is awkward and expensive. Although it accurately measures percent of body fat, it does not measure distribution. You don't know, for example, if the person is an apple or pear shape. Waist to hip ratio does measure distribution of body fat. Body mass index, or BMI. Body weight in kilograms is divided by height in meters squared. This is the most frequently used measure of obesity today. A BMI of between 25 and 30 is overweight, exceeding the desired weight for a person of a given height, age, and body shape. A person with a BMI greater than 30 is labeled obese. A BMI of 40 or greater is considered morbidly obese. The Metropolitan Life Charts reflect weight ranges with lowest mortality. Obesity is associated with atherosclerosis, hypertension, diabetes, some forms of cancer, gallbladder disease, and arthritis. Obesity also increases the risk in surgery, anesthesia administration, and childbearing. Obesity and early mortality. Women who were 30% overweight were more than 3 times as likely to develop heart disease as women who were of normal or slightly underweight. The risk increased to 5 times that of normal weight women among overweight women who were also smokers. Childhood obesity. Stats from 2009-2010 indicated that approximately 17% of U.S. children ages 2 to 19 are overweight or obese. Over 1/3 of U.S. middle and high school age children are overweight or obese. This proportion is projected to double by 2013. The prevalence is greater among boys than among girls. The cutoff for obesity at age 8 is a BMI of 18, at 12 a BMI of 23. Obese adults who were obese as children reported higher levels of stress and have more psychophysiological problems than adults whose obesity is of recent onset. Why might this be? Factors associated with obesity. Recall that obesity is a function of both number and size of fat cells. Among the moderately obese, fat cells are typically large, but there is not an unusual number of them. Among severely obese, there are both large numbers and fat cells themselves are exceptionally large. What determines number and size? Family history. Twin studies show that identical twins are more alike in terms of weight than fraternal twins or siblings. Children are more likely to be overweight if they have a parent who is overweight. The impact of genetics on weight may be exerted, in part, through feeding style. A study of healthy infants observed from birth through 2 years old found that children who were later to become obese were distinguished by vigorous feeding style, sucking more rapidly, more intensely, and longer, with shorter bursts between sucking. Family size and number of obese persons in the home is related to childhood obesity and ability to lose weight. Family size may influence the extent to which parents can manage their children. But family history does not necessarily implicate genetics. Mason in 1970 found that 44% of the dogs of obese people were obese, as compared with only 25% of dogs of normal weight people. Clearly, the environment matters. Early eating and exercise experiences. 80% of all people who were overweight as children are overweight as adults. Socioeconomic status, or SES. Low socioeconomic status women are heavier than high socioeconomic status women, and Black women in particular are vulnerable to obesity. The differences were previously attributed to high-carb diets early in life, but this does not explain why SES is not associated with obesity in men and children. Obesity is a risk factor for obesity. Many obese individuals have high basal insulin level, which promotes overeating due to increased hunger. Obese individuals have large fat cells. They have the greater capacity for producing and storing fat. Dieting may contribute to a propensity for obesity. Successive cycles of dieting, yo-yo dieters, and gaining enhance efficiency of food use and lower metabolic rates in rats and humans. This may be explained by a selective preference for foods high in fat following weight loss.